is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
And back on Nevada Newsmakers, we're very pleased to welcome back to the program Annette Whittemore, founder and president of the Whittemore-Peterson Institute. Pleasure to have you here.
Thank you.
And Dr. Judy Mikovits, who is the research director for that same organization. Pleasure to have you both on the program. Annette, can we just start out with just a really brief, simple explanation of what neuroimmune diseases are, including ME and CFS?
Well, they're systemic diseases, and they impact both the nervous system and the immune system. ME/CFS is a very, very complex disease, and we believe that it is infectious, that there are many organisms involved, and that it's going to require quite a comprehensive set of treatments in order to bring about change.
The retrovirus XRMV that had shown up in research on prostate cancer was found, according to your research, to be in the majority of tests done on folks not only suffering from ME/CFS but also prostate cancer, correct?
Yes, correct, yes.
And what has been the result in terms of the worldwide reaction to this?
Well, we've had a really exciting year. We've had interactions with countries including Norway, Spain, Belgium, different groups throughout the U.S., in the southeast and in the northeast. So many groups are into the research, excited about the research, and actually detecting XMRV in their patient populations.
4 papers were published this week in the journal Retrobiology, and according to the Wall Street Journal, demonstrated, according to the authors, how easy it is for mouse contamination to skew lab tests involving XMRV. I'm very excited about this, to get this right. Give us your thoughts on that, and
I'll let Judy speak to that, definitely.
Well, yes, I mean, we've shown in the paper that we published last year, and in a confirmation study done by Harvey Alter and Shai-Xing Lo at the NIH and FDA, that it's necessary to do multiple different kinds of tests, that one single test won't give you clear detection of XMRV, and because it's so closely related to some mouse viruses, it's very important not to work in a mouse lab and to actually isolate the virus and show an immune response in the patients to the virus. So multiple tests are the way to detect the virus, and we were well aware that it was easy to have contamination potentially skew the results.
Were you surprised at the response to these papers?
I was. I thought that it was a well concerted effort by this group to make sure that everyone knew about it prior to our being able to have a response, and we really weren't notified and given that opportunity. So we wanted to thank you for this opportunity, really, to be able to respond and to pretty much calm everybody down and let them understand that it really doesn't change the findings, it doesn't change the work that we've done whatsoever, and that we're moving forward in a very positive way.
What do you think the motivation was behind this, that they didn't contact you, as you guys were the prime research center?
Well, it's difficult to comment on the motivation of others, but I think it is an attempt to make certain that you know, maybe that the patients aren't served, and that XMRV is not an important. I think there's a great fear about the public health risk of this virus in this disease and in cancers.
Okay, would you explain that a little bit more deeply there?
Mm-hmm. Well, if our results and the confirmatory results that were published in August of this year hold true, as many as 20 million Americans could be infected with a new human retrovirus of uncertain pathogenic potential. That means you don't have to get sick, but you might. So as many as 20 million Americans, and that's 20 times the amount of HIV that was in this country at the height of the HIV epidemic in 1995. So I think there's a great concern for the public health, and that's why everything that's published about XMRV gets great attention each time.
And one of the easiest ways for people to understand a retrovirus is AIDS, correct?
That's a good example, and then there is another one, HTLV1, and certainly looking at those viruses you can learn something, and they understand the retroviruses and how they integrate and so forth. But this is a brand new family, never found before in human beings, and so I think there's a lot to be learned, and before we make any clear statements, we want to do the good, hard research, and we certainly, I am very, very proud of our group and the fact that they didn't take their first results and simply go with those, but really looked very, very long and hard at this and took 4 different methods to just be absolutely sure they knew what they found.
Whenever there's a discovery like this, and this is a huge discovery, and out of Reno, Nevada, which is wonderful, but there's always going to be a huge fight in the medical community when you have these kind of changes, correct?
Oh, absolutely. It is a huge discovery, and as I said, of potential public health high significance. So it's always going to be a level of understanding. We all have to learn how to detect the virus, what to study. There's just a lot of that has to be learned. So there's always going to be a lot of pushback because, of course, the best science generates more questions than answers, and that's certainly what's happened here.
Okay, let's take a break. More on this topic when we come back.